Welcome back to the MediByte channel. I'm so thrilled you're here. Let's just dive right into this explainer, shall we? Today, we're going to demystify two super common, but honestly rarely discussed cervical conditions. As healthcare professionals, we totally get that the unknown can be a bit intimidating, especially with reproductive health. That's exactly why we're shedding light on what actually happens when structural changes pop up in the cervix. Knowledge is literally your best medicine, and by the end of this, you're going to feel so empowered about your own cervical health. Here's our clinical roadmap for today's explainer. We'll start with understanding your cervical health, then move on to identifying and treating cervical polyps. After that, we'll cover what cervical stenosis is and how it's treated before wrapping up with our key takeaways. Section 1. Understanding your cervical health. We're setting the stage for our anatomical journey. Section 2. Identifying cervical polyps. Let's take a look at benign growths on the cervix. So what's really interesting about these protruding growths is that they're almost always benign, which means thankfully they are non-cancerous. If a doctor spots one during an exam, they usually look reddish pink, and they're pretty small, typically less than ½ an inch across, so about 1 centimeter. Basically, they're just these little finger-like projections of tissue that have decided to grow right into the cervical passageway. And get this, it's actually incredibly normal. Something like 2 to 5% of women have cervical polyps, so if you've got them, you are definitely not alone. But you might be wondering, why do they form in the first place? Well, medically speaking, these little growths are often just caused by something as simple as chronic inflammation, or maybe a localized infection in the cervical tissue. Your body just reacts to that irritation by growing this extra, totally harmless tissue. So how do you even know if you have one? Well, usually you don't. Most women experience absolutely zero symptoms. But it's still super important to pay attention to your body because these polyps are basically soft tissue packed with blood vessels. They can sometimes bleed. You might notice this as spotting between your regular periods or maybe a bit of bleeding after sexual activity. In rare cases, if the polyp itself actually gets infected, you might see a pus-like discharge. If you ever experience any of these abnormal symptoms, it's definitely time to loop in your doctor. Section 3. Treating cervical polyps. Let's talk about simple and painless removal. The good news? Treatment is remarkably straightforward and usually entirely painless. Here's exactly how it plays out. First, your doctor spots the polyp during a standard routine pelvic exam. And right then and there, in the office, they can just remove it. Since the tissue doesn't really have deep nerve endings, you don't even need an anesthetic. If there's a tiny bit of bleeding after it's removed, which is super rare by the way, the doctor just dabs on a little substance called silver nitrate with a swab to stop it instantly. Finally, just to be absolutely certain and give you total peace of mind, that removed tissue gets sent off to a lab to confirm there are no abnormal cells. For the vast majority of cases, that quick little office visit is the end of the story. But, we always prioritize safety here at MediByte. So, if your symptoms, like that spotting we talked about, happen to persist even after the polyp is long gone, your doctor will want to dig a little deeper. They'll do what's called an endometrial biopsy. That literally just means taking a microscopic look at a tiny sample of tissue from the lining of your uterus, the endometrium, just to confidently rule out anything more serious. Now, to build a bit of clinical contrast here, while polyps add extra tissue mass into the passageway, our next condition is all about the actual walls of the passageway closing up. Think of it like this. A polyp is like a roadblock placed on a street, whereas this next condition is like the street itself shrinking down to a tiny alleyway. Section 4. What is cervical stenosis? We're looking at what happens when the passageway narrows. Imagine a closed-off passageway totally disrupting the natural flow of the reproductive system. The cervix is fundamentally supposed to be an open channel, right? It lets menstrual blood exit the uterus, and it allows sperm to enter. But when cervical stenosis occurs, that critical doorway becomes abnormally narrow, or in some cases, it can completely fuse shut. Now, our bodies don't just close this passageway for no reason. The root causes of stenosis almost always stem from another condition, or they pop up as a side effect from a medical procedure. The most common natural cause is actually menopause. As estrogen drops, the cervical tissues can thin out and atrophy, and that leads to the narrowing. Other times, it's just scar tissue forming. This can happen after surgery for precancerous cervical changes, after an endometrial ablation for heavy bleeding, or even following radiation therapy. And yes, in some instances, it can also be caused by cervical or endometrial cancer. Much like polyps, cervical stenosis often causes absolutely no symptoms at all, especially in postmenopausal women who aren't menstruating anymore.
But for those who are still menstruating, a blocked doorway creates a real mechanical problem. It traps menstrual blood inside the uterus. Medically, we call that hematometra. Or occasionally, it can trap pus, which is known as pyometra. This trapping effect can literally lead to a physically bulging uterus, pelvic lumps, totally missed periods called amenorrhea, or incredibly painful periods known as dysmenorrhea. And in rare instances, for premenopausal women, it can cause infertility, simply because sperm cannot physically pass through that blocked cervix.
Section 5. Treating cervical stenosis. Let's talk about reopening the pathway.
The diagnosis itself is a highly practical, really physical process. Doctors usually suspect stenosis when they're doing a routine exam and they simply can't insert a standard instrument. So say they're trying to get a sample for a routine pap smear, an HPV swab, or an endometrial biopsy, and the instrument just will not pass through the opening. That physical roadblock basically confirms the diagnosis. Depending on your age and symptoms, they might run a few extra tests just to safely rule out any underlying cancers.
So the solution here is really progressive. First off, if you have stenosis but absolutely zero symptoms, which again is super common after menopause, you don't need any treatment at all. We just leave it alone. But for symptomatic women, the goal is to gently reopen the cervical os, which is just the medical term for the opening. Doctors do this by inserting small, lubricated metal rods called dilators. By progressively using slightly larger dilators one after the other, they physically and safely stretch that opening wider. Sometimes, just to make sure it doesn't close right back up while it heals, they'll temporarily place a small tube, called a cervical stent, in there for about 4 to 6 weeks. That keeps the pathway clear and relieves your symptoms for good.
Section 6. Takeaways and MediByte outro, because knowledge is your best medicine.
The absolute most reassuring takeaway from all of this is that both of these conditions are incredibly manageable. Whether you're dealing with the little finger-like growths of a cervical polyp or the structural narrowing of cervical stenosis, modern medicine handles these with straightforward, often in-office procedures. They're almost always benign, and they are incredibly easy for your healthcare provider to identify. But here's the catch. Because both polyps and stenosis frequently present with absolutely zero symptoms, you might never even know they're there unless a professional takes a look. Your cervical health is absolutely vital to your overall well-being. Staying proactive with regular checkups and keeping up with your scheduled pelvic exams is literally the best way to catch these silent conditions early and ensure everything is functioning exactly as it should. Thank you so much for taking the time to explore your reproductive health with us today. When you truly understand how your body works, you take the power right back into your own hands. But I want to leave you with this thought. Since these changes can be totally silent, how well do you truly know your own baseline? If you found this explainer helpful, please empower others by sharing it. And don't forget to like and subscribe to the MediByte channel for more clear, reliable medical explainers. Until next time, stay informed and stay healthy.